I'll share the screen.
Thank you. This talk is about some aspects of how prepared our health system is to face this pandemic. And
yeah. Don't worry, I'll be doing it.
Every day we are seeing in the news that there is a continuous increase in the number of cases, new cases, and deaths also. Every day the reporting is telling us that the numbers are rising, and now it appears that India has the third largest number of cases in the world, globally, only following the USA and Brazil, I think. And so we need to look at how are we comparing actually with other countries globally, not only in the numbers, but also we are, also we know that the denominator is also very important, right? So we need to understand also what are the rates that we are experiencing. I was hoping that Godwin would have the slides up, but I think it's taking a few minutes. But I have a table, which hopefully we'll be able to see very soon, which essentially is showing the top 5 countries globally right now that have the largest number of cases. And these are, of course, the USA, followed by Brazil, and now India has 3rd place, followed by the Russian Federation, and then we have South Africa. Now, if we look at the number of cases that these countries have, there is quite a range. The US has currently more than twice the number of cases that we have in India. So they have close to 5 million cases. We currently have about 2.2 million cases. And the deaths in the US are close to, or maybe even have crossed 160,000, while our deaths are closer to about 44,000, 45,000 at the moment, about 1/3, or less than 1/3 actually, what the US is experiencing. Now, in the US, they have now declared that it is a case of community transmission. Now, what does community transmission mean? It means that the virus has already gone into the general population and it is being spread amongst the general population. Whereas in India, it is still being classified as clusters of cases. Clusters of cases means that the virus is still, or the infection is still concentrated in groups of communities based on their risk factors. Now, if we look at the data, and I'm waiting, hopefully the table will come up soon. If we look at the data and you look at the denominator being the population of the country, then you see that the cases per 100,000 population there's a huge range between these top 5 countries. So if you look at the USA, cases per 100,000 population, there is almost 1,500 cases. And the deaths per 100,000 population is almost 50, right? If you look at Brazil, it is about 1,400 cases per 100,000 and about 47, very close to 50 there also, in terms of deaths per 100,000. Similarly, in Russia and in South Africa, it is 600 and greater than 900 per 100,000 population in terms of cases. And the deaths per 100,000 are much lower. It is 10 and 17. But if you compare it to India, we have 156 cases per 100,000, around 160, let's say. And the deaths per 100,000 are at about 3. Now, this is the data that also the government has been sharing to kind of give some sense that although the numbers are increasing, and they're increasing quite alarmingly, still we are not as badly off as some of the other countries in the world. But these numbers don't tell the whole story, because one of the important things to observe is that in USA and in Brazil, the numbers are sort of leveling off. They have not leveled off at a very low level. It's at quite a high level, but still they seem to be leveling off. And in Russia and in South Africa, they are actually on a downward trajectory. India, out of those top 5 countries, India is the only country where we are still on a steep rising trajectory. Now, this is important to keep in mind because it kind of indicates to us the challenges that the health system is going to face for time to come. In some of these countries, they may be able to say that we have gone past the peak. So the health system has already faced the worst and is now hopefully going to get better. But we are not in that comfortable situation. We are still on the rising trajectory. So we can expect that our health system is going to be under a great deal more stress than it is currently. That is one issue. There is also some interesting data that is being published about how the health system is actually gearing up in the past few months. One of the important indicators of how the health system has geared up is the testing. In March of this year, I had written a small piece that came in the Deccan Herald here about how India was really lagging behind in its testing. And even though at that time, even the US was lagging behind, India was lagging even further behind than that. But, and the reasons for that low level of testing at the time was one, that we didn't have enough testing kits. And the other was that our lab capacity was very poor to even process the tests that were being done. But in the last 3 or 4 months, things have changed. And a large number of laboratories have been certified to do the kind of analysis that is required of the tests. Plus, a large number of tests have been made available of different sorts. There's the RT-PCR test, all of you must have heard of that. There is antigen testing and so on and so forth. So at the moment, India's testing rate has gone up to about, let's say, 17,000 per million population. Now, of course, if you look at the global numbers, the UK, which has the highest testing rate in the world, is at 258,000 per million population, as compared to 17,000 in India. Russia is at greater than 200,000 per million. The USA has really ramped up testing, and it is at about 190,000 per million. Brazil is greater than 60,000 per million. And South Africa is also far ahead of us at 53,000 per million, which means that we have a lot of catching up to do. And why am I stressing testing? It's because globally, it is now established that testing, increasing testing as far as possible, then contact tracing, and then treating and quarantining and treating. These are the now established ways in which this virus can be contained over a period of time. So the more we test, yes, we will find more cases. And that's important, because when we find more cases, we can trace their contacts. Those contacts can be quarantined and watched, and they can be treated in early enough that the chances of survival become very good. It is when people are not identified and not treated early enough that they will end up being in hospital and then all the issues with the quality of care and so on, all that will come into play. Now, when we talk about India, as you all know, India is not, uniform. It is one country, but it has many variations, regional variations, and state-wise variations. And unfortunately, the presentation is still not up, but there is another table that I have here, which talks about the top 5 states. Top 5 in what sense? The 5 states that have the largest number of cases and largest number of deaths. And I also put Kerala in there, only because I know all of you will be interested in seeing the status in Kerala, although it is certainly not one of the top 5 states, but it's only for your own interest. Now, the top 5 states are Maharashtra, Tamil Nadu, Andhra, Karnataka, and Delhi. And the range here again, as we were seeing with the countries, is quite high. Maharashtra has greater than 490,000, in fact, about 5 lakh cases by now, and more than 17,000 deaths, right? Delhi has 143,000 cases and 4,000 deaths. Similarly, Karnataka has 170,000 cases and about 3,000 deaths. So there's a big range in the number of cases as well as the number of deaths in each of these states. Now, if you look at states like Maharashtra and Delhi, what you find is that their deaths per 100,000 population are many multiples of the national average. Oh, thank you. Thank you, Godwin. Can we go to the next and next? Next one. Yes. No, the previous one, please. Yes. Next one. Just stop here. Yeah. So I was just talking about this particular slide. If you look at the deaths per 100,000, you will see that Maharashtra and Delhi by far exceed the national average. Andhra and Karnataka are more or less at the national average, and Tamil Nadu is a little bit higher. You will notice that Kerala, although the number of cases is about 33,000, the deaths are very low. It's 0.25, which is, I mean, by far the lowest probably, certainly in India, probably even globally. Now, while these testing rates vary substantially, again, we come back to the trajectory of the pandemic, right? So Andhra and Karnataka, out of these states, are still on a very steep rising trajectory, right? Tamil Nadu is also still rising, but less steeply than Andhra and Karnataka. Whereas Maharashtra and Delhi, perhaps very cautiously, one might say, could be leveling off. None of them is actually on a downward trajectory, but at least Maharashtra and Delhi may be leveling off to some extent. And I say this with great caution because things change on a daily basis. One worrying issue is that Kerala is also on a steeply rising trajectory. And this is true of the deaths as well as the cases, right? So, even states which have relatively very good health system and states that are under a lot of pressure, they all seem to be somewhat, in the same boat to some extent. Also, if you look at the testing rates, what you see is that, can we go to the next slide, Godwin? Yeah, so this again talks about fatality rates, and it's pretty much a repetition of what we talked about earlier, that India has one of the lowest case fatality rates. And in the states, if we look at the states, we see that Gujarat, Maharashtra, Delhi, MP, Punjab, and West Bengal have death rates that are above the national average. whereas the other states seem to have a death rate below the national average. And of course, Kerala does not even appear here because it is much, much lower even than Jharkhand. Next slide, Godwin. Yeah, so then if we look at the tests per million, earlier we looked at tests per million globally. Now if we look at these different states, Goa leads all the rest. They have done 90,000 tests per million. And their positivity rate is relatively lower at 5.4. But if you look at states like Delhi and Maharashtra, their positivity rate is quite high. But let me say this, that in the other states as well, Andhra, Tamil Nadu, Karnataka, and even Kerala, the positivity rate has been rising. I remember not too long ago, Kerala had a positivity rate of 1.8, 1.4. It has gone up to 3.2. Karnataka, that I have been watching quite closely, started off also at 2.8. And look, it has come to 10% positivity. Now, why is this cause for concern? Again, it goes back to what will be the challenges that the health sector will be facing. Because this just shows that there are the infection is increasing, the virus is spreading, and more people are getting infected. And as and when they are tested and they are identified, then more and more people will have to be taken care of by the health system, right? And let me say that these states that are on the slide right now, again, are probably those that have a stronger health system. Now, the testing is increasing in places like Bihar, in UP, West Bengal. And slowly the numbers of cases, also in Telangana, numbers of cases are rising. Now, as they start rising, we will start seeing that some of these states will also be facing a crisis situation that Karnataka is facing today or Andhra is facing today. And then we will have to think about whether those states have a health system that is going to be able to cope with those challenges, right? Now, the next slide, we seem to have lost the slides, but I'm sure Godwin will bring them back. But the next slide shows an interesting sort of index, which is called the Global Health Security Index. Now, this Global Health Security Index was essentially looking at pandemic preparedness. And it was done as recently as in 2019, when people did not even realize that there was going to be a pandemic of this magnitude that was going to hit the entire globe. So in that index, actually, India ranked 57th out of all the, I think, 195 countries that were rated. And basically, the score that India got on that particular index was about 46.5. Which was better than many other countries, although it was not as good as, let's say, Indonesia or Thailand. There were a few elements on that index that India did quite well on. It did well on communicating with healthcare workers during a public health emergency. It did well on trade and travel restrictions. It did well on laboratory systems and on immunization. And it also did well on socioeconomic resilience. The things that it did poorly on, these are very interesting. The things that it did poorly on were zoonotic disease prevention. Now, as we know, COVID is a zoonotic disease. Secondly, it did poorly on emergency preparedness and planning. And unfortunately, this kind of emergency requires that the health system be well prepared, and that it has a plan in place to be able to respond to this kind of a challenge as and when it comes along. But India scored poorly on that. It also scored poorly on some of the things that were very critical, which were capacity of health facilities. If there is one thing that we need at this time, it is our health facilities to be functioning at full capacity. But the capacity of facilities was poor. The other dimension on which India performed poorly was on healthcare access. We know that access to healthcare services is a problem in India. There are issues of equity, which we will come to later. And this is true even for our normal health services, not even anything to do with the current pandemic. So some of these issues that came up pointed to the fact that India would face substantial problems if and when a pandemic hit. And sure enough, just a few months after this index was calculated, a pandemic did hit us. Now, the Brookings Institution did an analysis of India's response to the pandemic. And one of the things that they pointed to was that some of the early actions that were taken did perhaps, this is arguably, did slow down the spread of the virus. And these include, for example, these efforts include the travel advisories and restrictions, efforts to repatriate and quarantine Indian citizens, also the lockdown, which India was one of the countries to institute a lockdown the earliest. Unfortunately, some of the actions that were taken subsequently perhaps reduce the effectiveness of that lockdown, definitely. But the initial actions taken perhaps did help to slow the epidemic down in the early stages. Now, when we look at all this information, what we see are two separate kinds of issues. One is that to deal with the pandemic, the health system needs to gear up, right? And this means not just specifically in terms of the COVID, right? And the testing and the tracing and the quarantine and, all of that. That's very, very critical, of course, in order to be able to contain the epidemic and to continue to say that it is actually focused in clusters, which many people are beginning to question. But if we want to maintain that, then testing, contact tracing, quarantine, all of these are extremely, extremely important. But equally important are to be able to treat people early. And now there are, in the last 3-4 months, many new treatment protocols have come up. And so how do we bring those treatments, those drugs, medicines, services, how do we ensure that people have those early enough so that their disease does not, their condition does not deteriorate, right? To the point where they need to be on a ventilator or they need to be in ICU. So that is one very important issue. The second is that let us say that people, despite the best efforts, they do deteriorate. Then do we have enough ICU beds? Do we have enough equipment, ventilators and other equipment to be able to address the needs of these people? Now, the thing is that in cities, let us say in a city like Bangalore or a city like Thiruvananthapuram or a city like Delhi or Bombay, You may say that such facilities are available and they can be made available for a large number of people. But we all know that the availability of services in India is highly skewed towards urban areas. And in the rural areas, there is, it's very difficult to access some of these more advanced kinds of treatment. So what happens there? How do we address those? And we need to say that even though ICU beds have been identified, even though more and more ventilators have been made available, all of that is happening. But we still cannot assume that these will be made, these services and these treatments will be made. We can't take it for granted that everybody will have access to these services, right? Even in states where there are better health services available, we know that those health systems have collapsed. In Maharashtra, it has collapsed. In Delhi, it collapsed. And, it's only after the number of cases and so on started to reduce that the system was able to gear up again, right? Oh, good. So can we go not to the next, but to the next slide? Yeah, next one. Yes, this is good. This is good. We'll stay here. So the other issue also is that where are the doctors? Where are the nurses, the paramedics, right? At this critical time, those gaps are becoming very obvious. The fact that we have such a shortfall, especially in the public sector, of doctors and nurses is now becoming obvious. And so many doctors are so terribly overworked. So many nurses are so terribly overworked that either they are falling sick or they are, not able to come to work. In fact, in some places they are striking as well because they haven't even been paid. These are the kinds of weaknesses, gaps in the system that when under this kind of stress, they come up to the forefront. And you begin, and it becomes obvious that the health system is not really capable of dealing with this kind of a huge crisis. Now, in all fairness, even in countries which have better health systems, they have faced these crises. But unfortunately, in India, what we know is that the health system is chronically underfunded. And even under normal circumstances, it is under a great deal of pressure. There are shortages in terms of staff, there are shortages in facilities, there's shortage in equipment, there's shortages in drugs and consumables. All of these elements are in shortfall because the amount of money that is allocated to the health sector is so very small as compared to many of even our neighboring countries. Because of this, unfortunately, what some of the reporting more recently shows that there is a trust deficit. People do not trust that the government is going to be able to provide them with the kind of health services that they need, especially in a time of crisis. And so going to a government hospital is something that people would not like to do because they don't believe that the quality of care is good enough. They don't believe that they will get the appropriate type of care. And this is a real problem, especially when you combine it with the issue of stigma, because now with all the kind of messaging that is going out about, how dangerous this disease is, how it can cause, mortality, and plus so many other kinds of after effects, etc. People are hesitating to come forward and get tested and identified as being positive. because they're afraid, number one, that they will be at the mercy of the government system, which they don't trust. And secondly, they are afraid that they will become labeled and stigmatized by even their neighbors and their community and their friends. So these issues are actually causing problems in terms of getting to know the true magnitude of the issue. The second thing that we must bear in mind is something that Godwin referred to earlier, which is that this COVID is not the only crisis that the government is dealing with right now, right? At the same time that COVID is going on, the usual problems that people go to the health system for, they are still persisting, right? People still are having babies. People still have heart disease. People still have, other health issues. They can't keep it, waiting until COVID subsides, right? So what are some of the data telling us? That, as Godwin mentioned, between 1 to 2 lakh children have already missed their vaccinations, right? And this is, we are talking about in February and March. Since then, we have already another 3 or 4 months have gone by. So even more children have missed their vaccination. TB treatment. TB patients have not been receiving treatment. And in fact, the Stop TB Partnership has estimated that between 6 to 20% excess mortality may result because of COVID and the lockdowns and the poor access to normal services of the health system, right? Antenatal care, maternal deliveries are not happening in government hospitals. So apart from the COVID, morbidity and mortality that are associated with COVID, now we also need to worry about the morbidity and mortality associated with other disease conditions that the health system is simply not able to cope with, because this COVID has so completely already sort of overtaken whatever capacity is available with the health system, right? So the long-term impact of COVID is staggering, but the long-term impact of other health conditions is going to be even more staggering. I think that's something that we need to keep in mind. So in terms of health system strengthening, what are some of the lessons that we have learned from this particular pandemic? First, we have to recognize that there is no alternative to a strong primary healthcare system. This means that our frontline workers, whether it is the ASHAs, the ANMs, or the Anganwadi workers, they have been our eyes and ears on the ground. And we need to support them. We need to strengthen their hand. We need to give them more training. We need to give them more resources. This is very, very important. Second thing is that we need to bring communities into this effort. So for example, I know that in Kerala, a very good job has been done by the panchayats and by local communities in terms of not only addressing the needs of COVID positive patients, but also the needs of others in the community who have suffered due to not just the health crisis, but the humanitarian crisis. Because side by side with our health crisis, we are also experiencing a humanitarian crisis due to the lockdown and due to the loss of livelihoods and so on. So the strength of a state like Kerala has been the fact that at the community level, there are strong networks, right? The second thing is that the health system should be ready and equipped to apply the science, right? we can go to the next slide. So they need to be able to apply the science and, for example, testing, treatment, all these things need to take into account the evidence that is available and bring science and whatever statistics and data that they have and the social, the society, the community. These three have to be brought together so that the science and the data work for the betterment of society as a whole. It's not just, maintaining data for the sake of it, but what that data tells you in terms of where to intervene, how to intervene. These are they're extremely important, right? And finally, there needs to be much more support and funding for the health system. And this is so that the health system is strong at all times, not just strong at the time of a crisis. Because if it is strong and has the kind of, trust, credibility, and the resources to be able to respond to the normal sort of challenges that the health system faces, then at a time of crisis, it will be far better prepared to be able to step up and be able to address those crises. So the health system needs to be strengthened urgently, and this must be an ongoing priority, right? Not just scrambling to plug the holes when there is an emergency like this current pandemic that we are facing. And if that is not done, then it is almost guaranteed that the health system will collapse, as it is already collapsing in many places already. Whether it is Maharashtra, whether it is Delhi, whether it is Karnataka, all the states' health systems are under so much pressure. And the problem also is that the way that the public health system and the private health system, their relationship is so unclear. It is also fragmented, so that at a time of crisis, can we count on the private sector to step in and to contribute towards addressing a health crisis of this sort? Not always. So we need to have a proper regulatory framework or a policy framework in place that ensures that when we are talking about the health system, we're talking about the entire health system. Of course, strengthening the public health system is very, very important, and we need to invest much more in our health system. But at the same time, we also need to make use of all the resources that are available, and that includes the large, burgeoning, growing private sector. How do we bring that into the mix so that we're able to have an optimum response? I had a couple more things to say, but I think I'll stop here because it's already 8:20, and I'll take a few questions. And maybe in the course of answering your questions, I can refer to some of the other material that I also had. So Godwin, I can stop here and take a few questions.
Okay, thank you, Dr. Shreelata. It was excellent presentation because it's very comprehensive.
Godwin, I think we lost.
I just want to.
Yeah.
Is it okay now?
Yeah, now it's okay.
Yeah.
We lost you for a minute.
Okay. Yeah. Okay. Yeah. So excellent the presentation that you had. So let me just to start off with the discussion. Two things: one on the supply side, and another on the demand side, from the patient side as well as the other side. For example, if you look at the elderly are the one who have actually suffered or who absorbed the highest volume of shock in this particular period. Yeah, their health-seeking behavior or their health seeking pattern has been completely disrupted. Yeah. And if you look around, you would be able to attest that, a lot of people died, or means, around us. Yeah. Not able to seek proper, because, we are already facing huge, volume of burden of NCD. So, yeah, so that is the one side of the story. They face, not only this physical one, they also have, huge mental health issues. Of course, you are aware of. So, and because they are not able to visit any of the health centers, primarily because they are afraid, they might contract this one, and there are, especially many centers are even chasing them away. Means, go to some other hospital. They are not able to pay their money, so they can't even afford the private healthcare as well. So to what extent the existing, the first line treatment centers from the supply side can address that one? So do you think, from a policy perspective, can we separate, the COVID treatment in this kind of, centers, the, like, first line treatment centers, and the general patients, or the usual cases to the usual or the general healthcare setting, so that, the existing or the previous, whatever, minimum that we had can be recovered. So the pressure is on both sides. I know it's not an easy task. Yeah. So that's, I'll start with. I'll now get questions from the participants. So meanwhile, you can go ahead with this one.
Yeah, so I think that's a very good question, Godwin. And like I said, that, even the best of health systems have faced, a huge crisis. I mean, if you look at the UK, for example, or other Western countries, Spain and so on, they also faced a huge crisis, because in a sense, this COVID is unprecedented. I don't think anybody in their lifetime, I mean, even my parents, in their lifetime had never experienced, even during the Second World War, they had not experienced this kind of a crisis, health crisis. So, yes, we recognize that, right? And we have to acknowledge that. But despite that, could there have been, if our health system were more robust, could we have dealt with this situation more effectively? I think the answer has to be yes, although it is difficult. How can we really, keep in abeyance all other health conditions simply because we have COVID? I mean, people who have hypertension, people who have diabetes, TB, all of these conditions, they still need care. Now, if we had a really strong primary care network, at least some of these things could have continued routinely, because the kind of care that is required for people with mild symptoms or asymptomatic COVID patients is very little. So if our system was strong at the primary level, there is no reason why immunization should have been interrupted. There is no reason why normal deliveries cannot take place. Or antenatal care cannot continue as usual. Why is it that TB patients are not getting their DOTS treatment? It's not as if the pressure on the health system is uniform. It is not. The pressure at the primary level is not such that it precludes providing routine services. And I think what has happened is that it actually shows all the weak links in our health system currently, especially at the primary level. I hope that answers your. I mean, I don't know if that answers your concern, but just
yeah, of course, yes.
Part of our conversation.
Yeah, thank you. Yeah, thank you. What we are planning to do is, we'll be getting, the questions in the chat box. So I request, the participants to please, raise your questions in the chat box or type it. and I'll take it Dr. Shreelata permits. Maybe we have another 10-15 minutes for discussion, and I think I'm getting number.
Okay.
Can I ask you a question? I think it's not really a question, it's a comment.
Yes.
I completely agree with you that health services is important, but certainly there are problems in many states, especially Kerala. India invoked the century-old Epidemics Act, which gives immense powers to the police. And what I think is a marginalization of health services, especially health workers. The police took over. Recently, Kerala had this kind of an action. Some of us protested, but still it is continuing. So police, they have a greater role in this epidemics control than health services. So there are certain problems like that. The second issue is
I just want to agree with what you just said. And in fact, there are so many issues. So, in this talk, I could only cover a few. But the fact is that they are treating this as a law and order problem when actually it is a public health crisis and then a humanitarian crisis, And I completely agree that the Epidemics Diseases Act has taken us in that direction, which is completely inappropriate. Please continue. Yeah.
Yeah, the second issue, I will be very brief because the more I talk, the more profit I will be giving to cell phone companies. But I think the second issue is that you talked about science. The science is important. I agree with you, but science in this case is very weak. And because we don't know what exactly is happening, there are a lot of uncertainties. Even WHO is not sure what is going to, what are the symptoms. They keep on changing the symptoms every day. And 2 days back, they issued a new guideline. So it's keep on changing. And whatever preventive mechanisms that we have is the 18th century John Haygarth's levels of prevention, which enacted for smallpox prevention mechanism. And that we are still continuing with that kind of a science. So science is weak here, and therefore, when we requested to get accessibility to some of the data of the government, it was not given because a lot of confidentiality. And many other countries like Turkey and other countries, we are working on this country, Turkey, recently with one of my colleagues. They are giving access to those data. Even gender data is not available here. So what to talk about this kind of analysis? So that's my concern. I want to express it. Thank you.
Okay.
Thank you.
Thank you. Thank you, Dr. Nair. So, Dr. Shreelata, what I'm doing is now I'll take some of the questions, read you the questions from the chat box. So,
Sure.
Adarsh is asking a question that, since you have indicated the lack of infrastructure in rural areas, so how did this regional disparity in health system has actually aggravated the spread of COVID-19?
Well,
Am I clear?
see, it's the regional disparity in health system may not, the connection between that and spread of COVID-19, it's more complicated than that. But let me say this, that if the health system, in places where the health system has been relatively stronger, I can't say strong because it's not strong really anywhere, but relatively stronger, they have been able to ramp up the testing, for example. They have been able to more quickly turn around the results, the laboratory results. They have been able to identify those who are positive, trace all of their contacts, isolate them, quarantine them, and to some extent bring some semblance of control into the situation. Now, in those states where the health system is the weakest, they have not even got to the point of ramping up the testing. So the fact that they have fewer cases only means that they have not tested enough people. If they were to test then they would begin to understand the true magnitude of the spread of the virus in the community. And then they will have to have the capacity to be able to trace the contacts, quarantine them, isolate, give them first line treatment, and so on and so forth. So I think that the fault lines in the health system will show as the testing ramps up, more and more cases are discovered, and then the system is not able to trace and isolate people, is not able to give first line treatment, and that will lead to higher levels of mortality. That is, I think, the trajectory of this particular infection.
Okay, thank you. Okay, thank you. So now we have a question from our common friend Subrata Mukherjee, and his question is, what's your take on an ideal health sector in the post-COVID world, where public sector, private sector, community, and local governments will be strategically integrated for handling any public health emergency in future?
Subrata, thank you for that question. And I would be very happy to see an ideal system where the public and private and community-based system are integrated. But I'm not seeing that is happening at all. So let me just say just one element, right, which is the community. And we heard earlier on, 2-3 months ago, when Kerala, the idea was that Kerala had perhaps managed to control the spread of the virus. Subsequent events, perhaps it's not that clear anymore. But the strength was in activating the community bodies like the PRI and so on and so forth to take responsibility and to bring about community ownership, so that communities would be more responsive to the various messages and interventions and so on and so forth. But what I found was the directive that came down from the Ministry of Health and Family Welfare to the states to create the community level committees. They had specified that in each panchayat there should be a committee. And do you know that in that committee they made no mention of the Village Health Sanitation and Nutrition Committee, VHSNC. Their own, it's the NRHM's own community, NHM's own community did not find a place in this committee that was supposed to be formed for COVID. So where is the legitimacy of this community-based organization that is meant to be responsible for the health and safety of the community there, right? So if at this point we are not able to do that kind of vertical integration, then I don't know, later on, once this moment passes, I will not be very surprised if we just go back to business as usual. I don't see that, that reimagining is going to happen anytime soon. I wish it would, but that doesn't seem to be the way that we are going forward.
Thank you, Dr. Shreelata.
I don't know if I answered that, but...
Yeah, should be. We will be discussing more because we get more opportunities to meet. Okay, now I have a question from my colleague, Dr. Uma Jyoti. Her question is the functional integration between healthcare management and disaster management robust in India, though we have a national disaster management plan?
Yeah, well, the National Disaster Management Plan actually was in the process of being finalized, by the way. In December, I think, the WHO had brought the National Disaster Management Authority to the table to develop this plan, and specifically to address a pandemic of this nature. I don't think they had any clue that their plan might be required so urgently within the next 1 month or so. That plan, in fact, has not been implemented. So if it were possible, but the thing is that the National Disaster Management Act does not really is not really tailored for this kind of a crisis. It is more for earthquake, tsunami, that kind of a natural disaster, things that are maybe out of people's control, but which cause physical damage, physical dislocation. But this kind of a public health crisis, the Disaster Management Act really is not geared to address this. And, in December, like I said, that meeting was supposed to plan for a health disaster, which was not one of the central concerns of the National Disaster Management Act. But like I said, it probably hasn't been implemented. There has been no time to put it through.
Okay, thank you. Now you have one more question. You have a series of questions. Till you say no, I'll continue. Okay. Okay. Now Saya Chatterjee is asking a question. When will the urban-centric health system move to the rural areas of India? And if a vaccine doesn't come up on time, will the rural healthcare delivery system, which is already overstretched, won't it collapse? That's the kind of concern Saya Chatterjee is raising to you.
I think that's a very good question, and in fact, it brings me to one of the issues that I wanted to cover, which I, because of running out of time, I didn't get into that. But when was it? I think last week. There was, I think, on the 1st or 2nd of August, there was a headline that 25 people died every hour due to COVID-19 in India during July. That was the headline in the India Today. Now, that made me think and try to figure out some other data. And what it shows is that 50 people die per hour due to TB. 82 infants below the age of 1 die per hour due to preventable causes. 300 people die per hour due to hunger. Now, all these things are going along hand in hand with this 25 people dying per hour, but they don't really make the headlines. And I think that brings us very squarely to the issue of equity, health equity, right? And the reasons why these 50 people per hour are dying of TB or 82 infants are dying per hour due to avertible causes, etc., is this has been analyzed. It's a weak primary healthcare delivery system, poor health infrastructure, uneven access, right? And poor sanitation, malnutrition, health vulnerabilities due to overcrowding, poorly built environment, indoor air pollution, all of these kinds of environmental and other factors, which are what? All associated with poverty, right? So people are dying, the poor are dying, many of them in rural areas, but they don't make the headlines. And I'm not saying we should not be concerned about the fact that 25 people died per hour due to COVID. That's not at all my point. I think that's a tragedy. But these are also a tragedy, right? Which we don't really hear about. So I think this issue of equity that you have raised is a very important one. Because all these years, these things, TB and this and that, they're all called diseases of the poor. And we have become used, we are inured to the fact that people are dying of these diseases. And when the vaccine comes, I certainly hope that this issue of equity is kept in mind, because let's not forget that the polio campaign was launched, I think, in 1993 or something like that. Finally, we managed to eradicate polio when? In 2011 or something like that. It took some 17, 18 years before it could be eradicated. Similar for, even if we look at our normal immunization program, in some states, it is as low as 50% or maybe even less. In some states, of course, it is high, 80, 90%, but that's not a uniform, situation across the country. And who are the people who get left out? Of course, the people who get left out are the poor, the marginalized. And so I think when this vaccine becomes available, there should be very careful monitoring of how it is distributed. And I don't mean only in this country, even globally. It should not be that the vaccine is, sort of gobbled up by the richer countries who can pay for it and who will try to corner the market for their own citizens, but that it is equitably made available across the globe. And once it comes to India, that we are very conscious that the people who are most vulnerable should get it the first. And that's a huge challenge.
Okay, thank you. So would you mind taking up a few more questions?
Another 15 minutes, Godwin, I think is okay.
Okay. Oh, sure. Okay, so sweet. Okay, one more question. There are more questions. Another one. How China is answering this situation, given that they have a better health system? I would add to that. If from your understanding, which are the countries or the areas within countries who are doing much better or ideal in handling this particular outbreak or pandemic to be?
That's a very difficult question, actually, Godwin, and particularly questions on China I would not venture to answer, mainly because I'm not sure of the data, and a lot of it's very conflicted. Let me just say that the information on China, the discourse around what is happening in China, whether in fact the data is accurate or there is some issue with it, I'm very confused about it, actually, because the fact that they have been able to contain the virus in a way that no other country has been able to manage, that certainly makes you wonder, how did they do it? And if they were able to do it, why are they not sharing those lessons more widely? And the idea that they applied such stringent public health measures in terms of testing, tracing, isolating, quarantining, etc., in such a large country with such a huge population, so much so that they were able to completely, protect large parts of the country from the virus getting there at all. If they were able to do that, I think that's a remarkable accomplishment. But, I think I would like to educate myself a little more on this issue. I think generally speaking, in places where they have practiced solid public health, and as Mr. Nair said, these public health principles are as old as perhaps the plague. It even goes earlier than even smallpox, etc. As early as the Middle Ages, they knew about wearing masks, washing hands, maintaining social distance. These were simple things that people knew about a long time ago, you know, and in places where they've been able to really practice that stringently, like for example in Germany and so on, I think they've done a very good job of you know, communicating these messages, reducing stigma, making it a public health problem, not a law and order problem that people are frightened of, you know, but keeping an open and transparent system where people were able to come forward and at the same time convince them of the of taking sensible steps to protect themselves and the people that they are close to.
Okay, thank you. Now, Anup Velayathan has some specific questions to you. I think I'll read the 3-1 and probably you can, you know, combine it together. Would delineating an urban health system and therefore more planning for urban health be more useful, since, you know, now thanks to this urban conglomerate, cities are worst hit at the moment. 2, do we have an index to compare states in India to assess performance? 3, do you think health system resilience is critical to understand how health systems respond to larger outbreaks? If yes, how can we build in India? In India. That's what, you know, his questions are. Probably you can combine it and respond.
Yeah, so this issue of, you know, strengthening urban health systems, I think there has been a lot of talk about that because of other health challenges also in urban areas, and the focus on rural health, you know, that has traditionally been there. So urban health systems have largely been, you know, given over to the private sector to some extent. So when you say resilient health systems, yes, of course, health systems must be resilient. They must be able to be flexible and be able to quickly respond to any kind of new challenges that come along. But as a condition to this resilience, there should be a health system. You know, in the absence of a viable health system, and that is what has happened in many places now, that there is no functioning health system at all. Why? I mean, to talk about a resilient health system is too far down the road. You know, first of all, there needs to be a functioning health system where there is a network, there is a graded, you know, set of institutions, which we have on paper. You know, there is supposed to be at the primary level a PHC, then there is at the taluk level a hospital, at the district level, then tertiary level. All these have been thought through so carefully, but at each level there are huge gaps. And those, you know, the health system per se is, you know, is very fragmented at the moment. So I think the focus and the priority should be to have the health system as we know it functioning. And then we can talk about functioning, you know, in the face of a crisis, how will it function? In the face of something else, how will it function? Those come later.
Yeah, we have more questions. Dr. Sitara is asking, how far is the accessibility and availability of healthcare facilities being interdependent, especially with regard to, you know, the concern of migrant laborers, which is actually a hot issue at the moment?
Yeah, I think that's a very important question having to do with health equity and health justice, which are two interrelated and very important issues that we need to keep in mind. Especially migrant labor who have gone back to very difficult circumstances, because first of all, they have lost their livelihood. Secondly, they are having trouble accessing even the basics of life. I mean, even food, even shelter. They are facing also stigma when they go back. There's a lot of reporting of, they're facing a lot of aggression. They're being, excluded from their communities and so on and so forth. So this is an issue, I think, that is not confined to the health system alone. This is something that I think is, from a humanitarian point of view, needs to bring together a whole lot of other sectors as well. How do you, how do you provide sustainable livelihood opportunities for migrant labor, for example? How do you ensure that they have some kind of social safety net in the face of these kinds of challenges, for example? So these kinds of issues also need to be brought into the picture, and not just looking at health as an isolated sort of, service that is provided, but it's actually part of a larger network of social security, especially for, those who are most vulnerable, which is something that really is the need of the hour. More than, yes, we need to definitely strengthen the health system. There's no doubt about that. But how do we ensure that the most vulnerable sections are able to deal with not just the health implications, but also the larger implications that such a crisis has on their entire life? Every part of their existence has been impacted by this, and how can they be supported to overcome that? I think that's very important.
Yeah, thank you. Now, actually, we have a question. Which, that's what you have been saying. But now the question is, consider that the present pandemic is not a 100-meter kind of sprint, but it's rather a marathon. That's what many are now sharing. So in that kind of situation, your existing healthcare delivery system, revenue department, police department, sanitary waste, or collection, gathering, everyone are already stretched out to the maximum. Yeah, they're in a kind of demoralizing phase. Even now they are. Okay, so how do you visualize the next phase? Yeah. Because that in many states, the healthcare delivery workers, including Kerala, a part of their salary has been kept within the coffers. Yeah, and in many states, there have been delay in payments for most of these workers. So how do we visualize? Of course, we know that the chronic problem in our funding, where priorities are different. Yeah.
Yeah, I mean, even this opening up of the economy, now they're even opening up the gyms, and places where people come in close contact with each other are being opened up, right? But they have to, because, I mean, for example, in Karnataka, the first thing they opened up were the liquor shops, because that is the highest revenue earner, and they made a lot of money within the first few days. So there are certainly there is a huge financial crunch that the government is also facing, and at the same time, there are people who are working day and night at very poorly paid jobs, and even that they are not being compensated for adequately. So I mean, this is unfortunately the way that our system is set up. There's a handful of people, now one of our corporate giants has become the fourth richest man in the world in the middle of this COVID crisis. And at the same time, there are people, so the inequalities that are so much part and parcel of our system are now also that even that is being highlighted. And we are beginning to understand that the people who are the poorest paid and the most marginalized are actually the most critical people right now. For example, finally, I think people have understood the importance of the migrant workers. Whoever realized how much our lives depend on the migrant workers and the services that they provide. Now that they have left, now we are hearing in Bangalore, for example, they are being, asked, lured. I mean, in fact, people are begging them to come back, the construction industry, etc., saying, we'll give you this, we'll give you that, we'll provide better, housing for you, etc. All these years, they didn't even, spare a second thought for that, right? So I think, yes, this is going to be a marathon for sure. And I think, there's going to have to be some major introspection and policy change that ensures that people whom we normally think of as being at the bottom of the pyramid, now that we have realized how critical they are for our day-to-day living, what are we going to do about it? I mean, it could be even something as radical as having a basic minimum income, or something else like that. People have to now really start thinking out of the box and think about a radical shift in how and a change from business as usual, I think.
Okay, thank you so much. Actually, there are